What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and having a great day so far. It is time now for the Thursday edition of the Virus Update for Thursday, September 11th, 2025. If you are new to my channel, welcome to my channel. You just clicked onto today's Virus Update with all those viruses that can make us sick out there. Hey, you need a place that you can turn to stay informed on them. That's what I do here because the media really doesn't do much of that. I give you the latest news and data and anything I can find to help keep you informed on what's making people sick. Want to stay informed? Subscribe down below. If you like today's video, give it a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Alrighty, before we get into today's virus update, I just want to spend like a quick 30 seconds remembering what we just said at the beginning of the video, which is today is Thursday, September 11th, 2025. Yeah, we got to remember what happened back on September 11th, 2001. A day we will never forget here in the United States. I'm sure everyone knows where they were when the attacks on the United States happened in 2001. I, at the time, was 11 years old. The school buses showed up early at school. I'm going, what's this all? At the time, I was at a private school outside of the city, and teachers didn't understand why the school buses showed up. We didn't understand. We kept asking the bus driver, what happened? What happened? And of course, when I got home, I saw CNBC was on the TV. And I remember clear as day, I went, oh, that's what happened. The attacks of 9/11. So, let's just take a moment to remember all those who lost their lives on this day. If you want to share where you were when those attacks happened, you can do so in the comments down below. Alrighty, we do have several news stories today. I think about 5 of them, maybe 6. And then we do have some data to take a look at, including some weekly data. And you're going to see a mixed picture. You're going to see what's going on in the South and what's going on in the North, which is 2 different stories for COVID here in the United States. Starting off with this. Kids with COVID had a 50% to 60% higher risk of depression. Anxiety in 2021, researchers say. Yeah, it's good to have these studies, but some people do make the case that, oh, well, when they do these studies, that's what happened with COVID variants back then. What happens with COVID variants now could be a different story. Okay, yeah, true, but it's still important to know what could have happened back then because, you know what? There's still people dealing with the effects from being infected back just a few years ago. So let's read some of this. Relative to uninfected children, COVID-19 patients aged 8 to 17 years were at 49% higher risk for new onset depression or anxiety in 2021. That's not good. Rising to 59% in those with severe illness, according to a University of Utah study published this week in PLOS One. Yeah, that's really interesting. They have 154,565 school-age youth who had private insurance or Medicaid coverage. So, yeah, there was a lot of people involved in this study, and the average participant age was 10.8 years old, and 48% were girls in this study. So, but again, 49% higher risk, and then, of course, if it was severe illness, 59% higher risk. Yikes, that's not a good thing. I hear something else that's not good. The confusion around vaccines. Yes, I always say here on the channel, you do whatever feels right to you. I don't like to plant myself in the middle of this vaccine controversy. However, with that being said, I think it should be available for those who want to get it. For those who don't want to get it, fine. Ignore the vaccine. Don't get it. Don't get any of the boosts. Don't get whatever you want to get. But whatever you don't want to get is what I'm trying to say. But for those who want to get it, they should be able to. And some states are playing, follow the FDA guidelines, CDC, whatever. Some states are saying, we're taking matters into our own hands, and you get a vaccination if you want to, anyone who wants to. Well, it looks to me like Texas is going to go the route of, if you're 65 years or older, you can go out and get a booster shot for COVID. That seems to be the route that Texas is going to go. So many states are doing different things. It's very confusing. I wish we had all states, all 50 states in the United States on the same page. Of course, in other countries, Well, that gets even more confusing because some countries are saying, yeah, sure, go get it. And then some are saying, oh, no, no, no. So, confusing times, my friends. Dennis the COVID info guy, New South Wales. Respiratory surveillance reports week ending September 6, 2025. The COVID positivity rate in New South Wales was 3.5%. Hey, that's down slightly. Number of laboratories reporting 3 out of 4. COVID cases 1,334, down by 9.3%. Influenza. Now, this is down, but it's still pretty high. 6,003 new cases. Just one region of Australia. 13.3% decrease. RSV 1,229 cases, down by 20.3%. The NB.1.8.1 variant is at 57% of the cases. KP.3, 24%. XFG, 18% of the cases. And it does look like 2 regions of New South Wales are rising for COVID, and 2 are dropping at this time. Moving on now to some whooping cough news in Ohio. Kettering Fairmont High School is dealing with a whooping cough case. Yeah, this is not good. Kettering Fairmont High School alerted families Wednesday about a confirmed case of pertussis, commonly known as whooping cough in school. The highly contagious bacterial disease in its early stages appears to be nothing more than a common cold. However, we know it can go on to become quite serious for some people. So this is not good. Of course, it's another school illness. Yes, it will make the school illness tracking thread probably later this evening or tonight, tomorrow at the latest. Moving on to this. South Dakota is dealing with bird flu problems. Oh, yes. More than 100,000 turkeys killed in response. Yeah, so not going well for bird flu there. They are dealing with a problem. Matter of fact, it says a total of 134,000 to be exact. All right, let's go overseas. Let's go over to the United Kingdom, the UK. It is Thursday, time for their update on COVID cases, and unfortunately, they're going in the wrong direction this weekend, which is up. We don't want up. We want to see down. Weekly cases in the UK, 1,541. That's up by 102. Weekly deaths, 58. That's up by 5. Healthcare, 1,162. It says it's up by 157. Cases going up. That's a bad sign because we know so many people do not test or do the at-home test. So things not going well over in the UK at this time. All right, moving on now. Let's take a look at what's going on with bird migration here in the United States and see how many birds migrated in the last 24 hours. And you'll see it did once again go into the hundreds of millions last night. In fact, it did reach over 300 million birds last night. Take a look at that. And birds moving south for the winter. Yes, the colder months are upon us, and that 3 million was just at a given time. The total number over the course of the night, probably many million higher than that, maybe several hundred million higher than that. Taking a look at the website, anything new to show you here? Not really. I'm going to update some things either tonight or tomorrow morning. Taking a look at the viral activity levels in Canada, we have to see, did this make any changes? No. COVID-19 is still moderate. Flu A is low. Flu B is low. RSV is listed at low at this time. Let's take a look at the air qualities in the United States. While we're waiting for that, let's pause and take a hydration break, shall we? Water to drink of choice today. Didn't that taste good? Taking a look here, yeah, the yellows are starting to become more expansive, and the oranges and reds are still there in the northwest, even some purples. Not as many of that, but wildfire smoke is still causing bad air qualities and breathing problems in many different places, not just the northwest. Some of that is making its way down into the central and southern states. Taking a look at what's going on with EMS calls. Whoa, take a look at this in Pinellas County, Florida. We see sick person listed 1, 2, 3, 4, 5 times, and a bunch of other things. Headaches, just a whole slew of things here. They got hit hard with COVID. Maybe now some long COVID issues are going to start popping up there. Who knows? Philadelphia, 816 EMS incidents reported yesterday. Live looking at Montgomery County, Pennsylvania, shows a couple respiratory emergencies. Abington, yikes, I'm going to be in this Abington Township in just a little bit, going back to work. Cardiac arrest call. And then Springfield Township may end up there this evening. Cardiac arrest call there as well. That's not good to see more than one cardiac arrest call once. And wow, take a look at this. Cardiac arrest call right now in Westchester, Chester County, and also in Chester County. Not one, not two, not three, but 4 sick person calls right now, and a respiratory difficulty call. Yes, this is kind of building us up to something. The North. The northern states right now are on a rise when it comes to COVID. While the South is peaking, the North has not. Look at this. Bucks County, Pennsylvania. 15 calls right now, and looks to be just a general mixture of things. I do see respiratory distress. I see chest pains. I see a bunch of different things showing up here. Let's see how the Pennsylvania hospitals are doing. Hopefully this has improved. I'm going to refresh this. Not really. We're seeing a lot of hospitals in eastern Pennsylvania. You can see here. Northeast Pennsylvania, the Lehigh Valley, Southeast Pennsylvania, Reading, South Central Pennsylvania. Yeah, dealing with several hospitals, dealing with problems today. The good news is New Jersey is not doing too bad today. A specialty issue at Inspire Medical Center, Mannington, surgical divert. That's it. That's the only problem for the state of New Jersey. Should we go to New York now? Well, we have to go to New York. I really don't want to show you this. This is bad. Look at New York. The blue average line. New York City got added in today. Yeah, 1,140 new cases in New York. This is New York State. And someone's saying, oh, New York City has millions of people. There are millions of people nowadays that think COVID is over with and don't bother to take a test, don't care to take a test, I don't know, asymptomatic is real, or they think it's something, oh, it can't be COVID. That was so 2020. And, well, yeah, I did get sick with Omicron in 2021. I got news for you. COVID's still real, and the fact we are seeing this trend line now go upward, that's almost, you can see here, the number of new cases today is not a wave high. The wave high was on August 12th. But what is a wave high is this new average line. And 5.7 cases per 100,000 people. Yeah, so that average line, it's now almost going straight upward. Now, the hospital situation did not worsen today. 411 people in the hospital and 39 people in the ICU. So the hospital situation dropped a little bit. But you know what? The bad news does not stop with New York. There are other places still doing not so great when it comes to the north. Remember last week, Ohio looked like they may have leveled off and maybe peaked. Yep, that was last week. This is this week. Look at the hospitalizations in Ohio. Yeah, there was a correction and, well, an increase. Current week, 281 people in the hospital. Previous week, 227. Big increase for the state of Ohio. Both influenza and RSV numbers dropped. 2 in the hospital for RSV, just 6 for flu at this time, or otherwise known as influenza. But you get the idea here. Things in the north are still rising, and you can see when we take a look at the northern states, well, the whole United States is still listed at high when it comes to COVID. And let's take a look at that nationwide wastewater chart. We can see here SARS-CoV-2 high and, yeah, still rising. And the reason why wastewater still shows a rise, a little bit possible peak at the end, is because, number one, this data is a little behind. Number two, the north is still going up at this point. But now, what do you say? Let's take a look at some data from CJS and see what his numbers show today. Not a lot of data. It's his midweek update. And here's what his numbers show. First off, he does say that Florida. Now, I didn't read all of his, his paragraphs that he put in there with some notes on this, but he does say that it looks like Florida is starting to peak. That is some fantastic news. On Monday, Florida had 938 new cases and 2 new deaths. New York, 936 new cases. Puerto Rico also looks to be peaking. Puerto Rico had a daily number of 460 new cases. Texas, this is a little finish up from last week, still had another 8,341 new cases and 1,175 CDC reported hospitalizations. That is last week's hospitalization number. And they also reported 17 deaths. Tuesday, Florida, 1,594 new cases and 1 new death. New York, 670 new cases. Puerto Rico, 570 new cases and 12 new deaths. Given reported patterns, that figures to be their weekly death count. And yes, Puerto Rico is peaking at this time. Maryland, 1,480 new cases, 146 CDC reported hospitalizations, and 13 new state reported deaths. Maine, 190 new cases, 6 new deaths. Virginia, reports 4,190 new positive tests, nearly 4,000 for the week of August 31st through September 6th. 162 CDC reported hospitalizations and 4 CDC reported deaths. Wednesday, Florida reported 1,407 new cases and 37 new deaths. And let's pause there for a second. While Florida cases are likely peaking, it's possible Florida deaths may continue to remain elevated. Remember, deaths are the last lagging indicator. Well, the only thing after that would be the number of funeral calls that the funeral parlors get. New York, 557 new cases. Puerto Rico, 414 new cases. Oregon, weekly number, 354 new positive tests and 2 new deaths. Washington, weekly number, 994 emergency department visits and 9 new deaths. Going back to the browser here, tomorrow is Friday, which means we will get, hopefully, an update from the CDC. What surprises will they have for us this week? Honestly, I don't know. And by surprises, I mean, will they change something? Will they discontinue something? Will something new pop up? I don't know. But the key takeaways for today. The South is clearly peaking, and that includes way south in Puerto Rico, while the North is still, we're still increasing in the North. And you see New York State is still increasing. Honestly, I don't know how much longer New York State is going to increase. Historically, usually about mid-September, they peak. Will that be the case this year? Honestly, I don't know. You see states like Michigan still have really high COVID. Wastewater, yeah, you're seeing that everywhere on this map. But honestly, I think if there's a region that is going to go back to medium on this map first, unless there's a wonky movement, I think that would be the South. And I think that's going to be maybe before the month ends. But again, we'll have to see how fast things actually drop. There are some indications COVID in the United States may not drop all that fast. There's a couple forecasts, or I shouldn't say couple. There's one that I know for sure. It shows a drop and then a general leveling, which if we start off elevated for the winter wave, that would not be good. Alrighty, folks, that's all I have for today. If you like today's update, give it a thumbs up. Subscribe if you're new down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And of course, if you want to support the channel, you know, the work I do here on my channel, you can do that down below. In fact, some of the latest support I received, I'll be unboxing it here on the channel. And that is new masks. I'm probably buying them within the next week. It's time. I need new masks. I need another supply of it because I'm running low. Alrighty, see everyone again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Thursday afternoon. Thanks for watching.